Can hear, right?
Yeah, put play, let me see.
Hello, good evening. My name is
Yeah, it's working
Nonthalee
out. Thank you.
from Siriraj Hospital, Mahidol University, Thailand. I'm currently the president of the Thai Association for Gastrointestinal Endoscopy. I would like to thank Diogo for the opportunity. It is my pleasure to be part of this program today. My talk is entitled Endoscopy Unit Preparation. Preparation for bariatric endoscopy requires proper endoscopy unit setup, optimal patient pre-procedural evaluation, and adequate preparation of devices. Endoscopy unit setup should have proper room and bed for obese patients, CO2 machine because we're using CO2 during the procedure, electrocautery unit just in case we need to use APC, anesthesia machine and monitors. Medications like sedative agents and antibiotics should be available. Occasionally, we may use sequential pneumatic compression devices and Foley catheter. Optimal pre-procedural patient evaluation is also important. Basic labs, chest X-ray, EKG should be checked. Evaluation by anesthesia may be required in selected cases. Also, additional evaluation may be required in selected cases. Cardiac, pulmonary, and psychological evaluation may be required, especially in patients with super obesity, COPD, heavy smoking, and ischemic heart disease. In our center, we kind of modify the pre-procedural evaluation from the preoperative assessment. So the patient evaluation may be different depending on your institutional protocol. The device preparation depends on the procedure to be performed, and I will touch on this a little bit later in my talk. I think it is important to keep in mind that obese patients may need bigger bed, spacious room, doorway, and corridor for patient transfer. So be sure to consider these things when you set up a bariatric unit. This is a video that I'd like to share with you. I want to give you a tour of our endoscopy room for bariatric endoscopic procedure. Here we go. Welcome to Siriraj Endoscopy Center. Today I want to show you how we prepare our endoscopy unit for bariatric endoscopic procedure. So here is what our room setup looks like. You're going to see that what we have here, we're preparing the scope, which today we will be using a gastroscope with the scope tower and light source. We also have CO2 generating machine because we're using CO2 during the procedure. Also, just in case you want to use APC or ESD during TORI, you need to have electrosurgical cautery device here as well. And in this area belongs to anesthesia. Here you can see that we have the machine for sedation. We're doing the procedure under general anesthesia. So here's the machine. We have monitors and also infusion pump. So this is pretty much the equipment that we have getting ready before we bring the patient in. Besides the equipment, we also have an area for devices. So for today, we're going to be doing ESG. So you can see here that we get our devices ready for ESG. Also, if you want to do balloon or whichever procedure, this is going to be the area where we assemble the devices. So this is the room we have ready before we bring the patient in, and we have all this equipment and devices lined up. The device preparation depends on the procedure you choose to do. For the gastric procedures, there are various techniques like intragastric balloon, which you will hear more later, ESG, pose, aspiration techniques, and space-occupying devices. The small bowel procedures include gastrojejunal bypass sleeve, the incisionless magnetic anastomosis system, the endosphere, and duodenal mucosal resurfacing. So you have a broad variety of devices you need to prepare depending on what you want to do. For the ESG, there are two models available. The original overstitch model requires a dual-channel therapeutic endoscope. The recent model, called Overstitch SX, is compatible with a single-channel endoscope. So before doing the procedure, you should check and make sure that all the required devices and equipment are ready. For example, if we're going to do ESG with Overstitch SX today, then we would prepare a single-channel endoscope, and the helix, the sutures, and cinches ready in room, so that way we have everything ready to go. Once things are well prepared, the patient is brought in room, briefing is performed per protocol, the patient is connected to the monitor, and general anesthesia is started. For this patient, we place a pneumatic compression device and a Foley catheter, and then the patient is placed on left lateral position. This is one of the first few cases we did, so we elected to place her on pneumatic compression devices and Foley catheter because we expected that procedure might take a little longer. So we just wanted to make sure that we were able to monitor her urine output and give her proper DVT prophylaxis. And this is what it looks like during the procedure. We have anesthesia at the head of the bed with nurse anesthetist, and we have our nurse here helping with the device preparation. We have our fellow here taking care of the helix, and so it's nice to have anesthesia in room so that way they can sort of remind us of what potential complication might occur. For example, I want to briefly mention about specific anesthetic consideration for endoscopic bariatric procedure. It is mainly related to CO2 insufflation. High end-tidal CO2 can be found, but it can be corrected by increased minute ventilation, and it is nice to have anesthesia monitoring this for us. The complications include the high peak inspiratory pressure or post-op nausea, vomiting, bleeding or capnoperitoneum, subcutaneous emphysema. And so once the procedure is completed, the patient can be transferred to the recovery area. Nausea and vomiting may occur, and we can have anti-nausea and vomiting for that. And before I finish my talk, I would have to say that we would not have succeeded without the help from these two people right here. If you can see them, Pichmon Jarapino and Chris Thompson, who guided us through our first ESG virtually. And this is me, the first person who performed ESG in our country. And I was told that we were the first group ever who got virtual training in ESG in the midst of the pandemic. And with help from the Brigham team through virtual training, we were able to accomplish the first ESG in Tori in Thailand. So with that, I would like to thank you very much for your attention. And here is our team. We have just formed Siriraj Obesity Working Group, and we are on our way to establishing Center of Excellence. Thank you very much for your attention.